So my name's Tiffany Osei. I'm a fellow at the Women's Heart Center at Cedars-Sinai.
Okay, that's good to know. So, how was your experience with the retinal scan?
So I had a really good experience with it. It was pretty quick. It was like less than 2 minutes, and then got the results in about a minute. Yeah, it's an interesting test.
Okay. What do you feel about if the retina is introduced as a cardiovascular risk screening product? Do you feel there will be difference in the patient experience that they have right now with the CT scan?
So I think comparing, the retina imaging machine to a CT scanner, it is smaller. There is no radiation, which is a benefit. This is something that could easily be put in like a doctor's office, like a private practice. And I think it could be useful in areas that don't have access to CT machines. It could be a useful tool, but I would really love to see more research comparing this type of imaging to coronary calcium scores, which is what we most commonly do right now.
Yeah, definitely. I think the product, because it has been developed in the Korean population, we have a lot of validation in the UK Biobank. We have validation in the Singaporean, Indian, Chinese, Malay population as well. I think definitely the most critical part here would be evidence in the American population, right?
Yeah, we definitely need to see some more studies before we could start recommending, but I think as we see data and it's definitely could be a good tool we can use. Yeah.
Yeah, I think I totally agree with you. Perhaps we are at a standpoint wherein oculomics is something that is being introduced, and awareness building is a key phase right now. But the critical part that will be required will be the addressing of the safety and efficacy in the target populations. And to just let you know, we are working on that. So we should be able to give some new evidence, some new data by the end of this year. And hopefully, once we have that, it can be a product that can kind of fit into what cardiologists and anyone who treats cardiovascular risk has in their armamentarium. Thank you so much, Tiffany, for talking to us today.
Of course.
Thank you so much.
Thank you.